disease is commonly misdiagnosed. Even though my next guest works in the medical community, she was convinced her symptoms were simply a skin problem until she went to Hamilton Vein Center. Here to explain, please welcome Dr. Carlos Hamilton, along with his patient, Luann Zichas. Hello.
Hello.
All right. Luann, your story is going to be something that so many people watching right now are going to go, that's me, but they don't know what to do about it. You work in the medical community, but you had noticed something changing on your ankle a while back?
On my right ankle.
What was the change?
Well, actually, I guess it was last summer, I noticed that I had a little pinkish, it looked like a little rash. And I started putting medication on it, and it seemed like it didn't help it very much. And it went on like that. It stayed that way for a while.
You kept using stronger and stronger
and stronger creams, but it didn't work. So in December, I noticed that there was more discoloration in that area. And I thought, well, I need to talk to the doctor about it. And of course, I work for a doctor, and he's the one that referred me to Dr. Hamilton.
And Dr. Hamilton, this happens so often. People think it's a skin issue.
Yes.
It's what we can see on top when actually it's something that's happening beneath that's causing the problem.
Right. The veins underneath the skin get stretched out, whether they're bulging or not, if people have backward blood flow in certain veins, and it causes a rash. It causes inflammation, a rash, and people put steroid creams on it. It never works until the veins are addressed.
In fact, we have some pictures that we can show, because we've seen this with people that have, okay, there you go. Those are some severe cases right there.
So this is actually a mother and a daughter here, and so the mother's on the left here, obviously, and so it starts on the right, and then 20, 30 years later on, you end up with really dark skin and ulcers, and it's a whole lot better to treat this when you're on the right side of it.
Out of curiosity, you said it's a mother and daughter. Is this something that runs in the family?
Absolutely, it does. So if someone has vein problems in one of their parents, they have a 50% chance. If you have two parents, 90% chance. It's a lot easier to deal with this early on.
Luann, you're nodding your head when I said, is this something that runs in the family?
Yes, well, I don't know. Perhaps my mother had it, but I didn't know she had it, you know? You don't know that. She probably didn't know it either.
Yeah. Because a lot of times what they would do is again, try to treat it with creams and stuff, thinking it was a dermatology issue.
Right.
Now, the other thing is, when we think about our mothers having it, those who did find out what the problem was went through this process, sometimes called vein stripping, or which sounds like it's...
it's as bad as it sounds, and it really is. And so a lot of people know of a relative that had that done, and so they're like, I know what the treatment is, and it's worse than the disease. I'm just not going to have it done. Well, you know, the fact is, there's great treatment for it now, and Ms. Zichas is...
Yeah, modern technology has evolved, right?
It was amazing when I walked into that office. Such a lovely office in Sugar Land. It's at Sweetwater and Lexington. I'll tell you.
I've actually been in that office. It is a lovely office. Did you do your decorating yourself, Dr. Hamilton?
My wife did.
Your wife did, okay.
But anyway, that's important to me.
Well, your surroundings, that's true. But when you went in there...
When I went in there and I went into the exam room, what was interesting to me, I thought, I wasn't quite sure, you know, if this was the problem or not. And I looked up and saw those pictures on the wall, and I thought, oh, that looks like my ankle. Also, my ankle didn't look like, you know, some of those pictures that he has shown. But I knew I was in the right place when I saw that.
And you were going to catch it fairly early.
Catch it early.
The actual procedure today is nothing like vein stripping was. And it's like you're in and out, and it's really fairly easy.
Absolutely, it really is. And Ms. Zichas can tell us about her day after one of these. We treated her, and then I was like, well, I need you to go walk. And
oh, it was interesting. The assistant said, now it's time, you know, just hop down off the table now and get dressed, and you're ready to go. I thought, wow. So I did. And then when I got off the table, I thought, wow, my leg feels about 5 pounds lighter. I couldn't believe it.
Yeah, we're looking at some of the signs of what we call venous stasis dermatitis. And so there's that discoloration we talked about, but oftentimes people have what they call those Herman Munster legs.
Yes,
where it's,
they feel heavy, and you know, the skin will start to thicken, it'll get a rash. It's very itchy and dry skin that just won't seem to get better.
Syndrome.
Absolutely, restless legs. Cramps at night are very common with this, and
Altate is possibly a vein issue. So the process itself, and I've seen this process in the office, and I was amazed. Literally, what you do is tiny little needle goes through a catheter and collapses the vein. That's the problem.
That's it. We find it. We really do a lot of ultrasound, so we find exactly what the problem is, and we treat exactly what needs to be treated, and it fixes it. It's really great treatment.
Nothing painful. In fact, a lot of your patients will call you and say, like, you'll call to check on them after the procedure. Busy shopping. There's a sale right now. I got to let you go.
You got it. I know.
Busy. So anyway, again, if you have a relative who in years past had that thing called vein stripping, that's not the way it has to be done today, especially at this office. You can get a free consultation at the Hamilton Vein Center. There are several several locations. Their new offices are in Clear Lake, Willowbrook, and the Woodlands. For more information, you can call 281-565-0033, 281-565-0033. You heard him say if you get it taken care of earlier, then everything can kind of heal up quicker. Or visit their website at hamiltonvein.com. Out of curiosity, did your wife also decorate the other locations?
Yes, she did.
And they look good as well.
Yes, they do. She did a great job with them, yes.
Thank you, honey. Okay. Well, we know Facebook and Twitter, but do you know what the latest rave in the social media world is? We will tell you next.